We begin with an overview of the divisions of the ear into the external ear, the middle ear between the tympanic membrane and the oval window, and the internal ear we see represented here by the bony labyrinth of the cochlea and the semicircular canals. The external ear begins with the opening of the external auditory meatus, and you can see that the external auditory canal is lined laterally by cartilage, lateral 2/3, and the medial 1/3 by bone. So when you look at the skull, the external auditory meatus is starting right here where we see in this model the bony portion of the external auditory meatus begins. The external ear projects to the tympanic membrane. We can see the membranous representation there as the border for the middle ear. The middle ear is an air-filled chamber, and it has a communication with the pharynx through the pharyngotympanic tube, also known as the eustachian tube. The inner ear, as we pointed out, has a bony labyrinth. The bony labyrinth is lined by the membranous labyrinth. Laterally, we see the semicircular canals. Medially, the cochlea. I'm going to rotate this around posteriorly so you can appreciate where we are in the skull. Here we're looking at the posterior wall of the petrous portion of the temporal bone. That is the ridge before the skull drops off into the posterior cranial fossa. And we already know, I'm sure, the internal auditory meatus, where the 8th cranial nerve and the 7th cranial nerves exit the cranial cavity. That's what we're seeing here. In this, we have taken the bone off of part of the petrous portion of the temporal bone and can see, once again from a posterior view, semicircular canals and the cochlea. Another thing I'd like to point out before we move to the skull is that if you look in the middle ear, you can see the malleus, the head of the malleus, and the arm of the malleus. The arm of the malleus attaching to the tympanic membrane. The head of the malleus is actually usually just below the roof of the tympanic cavity, a portion of the temporal bone called the tegmen tympani, a very thin roof, a very thin portion of temporal bone. Between the head of the malleus and the tegmen tympani, we see the epitympanic space. Posterior to the epitympanic space, we actually see what's called the mastoid antrum. When we look in the skull, you can see the mastoid process on the inferior aspect of the skull. Illustrated in this model, you can see that deep in bone, we have spongy openings, pockets in the bone. And this open space in the middle ear communicates with some of the spongy bone of the mastoid process via this mastoid antrum. Infections in the middle ear can spread to actually infect the mastoid bone, the mastoid air cells. Another thing I'd like to point out, that hopefully we can see in the skull as well, is that from the malleus, we can follow a tendon. This tendon is supposed to be attached to this muscle right here, the tensor tympani muscle. As the name implies, it tenses the tympanic membrane. By pulling on the malleus, it will actually pull taut the tympanic membrane and dull or dampen the sound that is being transmitted from the middle ear to the inner ear by decreasing the vibrations of the tympanic membrane. So when one is exposed to loud noise, the tensor tympani muscle can contract and help protect the inner ear structures from excessive noise being transmitted. You can also see that the tensor tympani lies just superior to the pharyngotympanic tube. The pharyngotympanic tube, we can see portions of it that are in bone. The majority of it is a cartilaginous tube. There are certain muscles that actually have their origin on the pharyngotympanic tube, aside from the tensor tympani. Number 21 on this model actually points out the tensor veli palatini. We do not need to know its exact function now. It's involved with tensing the muscular part of the palate, tensor veli palatini. But its origin is partially from the pharyngotympanic tube. So when one contracts the tensor veli palatini, one can actually pull open the pharyngotympanic tube right here where it usually lies closed. Scuba divers and people who often fly will know about making the effort to open their pharyngotympanic tube so as to equalize pressure between the middle ear cavity and the pharynx, which is continuous with the outside world. When one swallows, one contracts the palate and may tense the tensor veli palatini, thus pulling open the pharyngotympanic tube.